talking to Dr. Rice, and he was telling me about first-line therapy, and we did some initial blood work to kind of see where I was. I'd known for years I had high blood pressure. We had me on some medication that had pretty much stabilized it. I knew I had high cholesterol, and those were things that I always thought, well, one of these days I'll get that in line. I'll deal with that. I knew I was overweight. I'm 6'4", and at the time I weighed about 282. That's why I started off 2012 weighing 282 pounds. That's 5 pounds from the highest I've ever weighed. So I knew I needed to do something. And I'd set a goal of trying to lose some weight, not a specific goal, but I'd set a goal of trying to lose some weight in 12. Well, I knew I had high blood pressure, I knew I had high cholesterol, but when he looked at my numbers and told me, he said, Darren, you're not pre-diabetic, but you're pre-diabetic, and you keep going on the rate you're on, you'll eventually be diabetic. And that to me was what clicked. I have no regrets at all going through the program, First Line Therapy. From the medical shakes that you take in the morning to kind of give your body some of the fuel it needs and correct some things on some molecular level, to looking at how you change the way you look at food. It's not just a diet. Obviously you're on a restricted calorie intake, but it's looking at the food choices you make. You want to eat healthier food, more natural food. Just because something's in the frozen section of the grocery store and says it's low calorie and it's diet doesn't mean that it's good for your body. You look at the chemical makeup, you look at all the ingredients that are listed on there versus something that's natural food, naturally processed. It takes a little bit more time to cook and a little bit more thought when you're at a restaurant and trying to figure out what to order. But as slowly as the weeks go by, you start to notice changes in yourself. It's not just the weight that comes off. You feel better. Your body is moving better. Some joints that were aching weren't aching as much anymore now. And yeah, the pounds come off, but my numbers, in my case, my cholesterol was 254. And by the time we were through with the program, my cholesterol was down to 188. Now, 188 is still somewhere in the high range, but that difference from 254 to 188, and that was accomplished purely through this eating program with no drugs, which means no side effects. We've all seen the commercials with the listing of the side effects and everything that can happen by this one drug that's supposed to cure this one thing, and then you have a list of 20 things it could cause. So I go from 254 to 188 with no drugs, no side effects. My blood pressure medicine, we halved it last summer, so at the time I was taking half my original dose, and then last fall we cut that in half again. That's where I'm at now, and they don't make that pill in a smaller increment. So my next step is to come off the blood pressure medicine, and that's the only medication that I was taking. So my cholesterol is now in line. I'm no longer pre-diabetic. Blood pressure is way down. I am way healthier than I was 9 months ago.